Thank you for your introduction and inviting me for this section. Today, I would like to present on the topic Key population lay provider can successfully link men who have sex with men to care after diagnosing sexually transmitted infections in community-based organization in Thailand. I declare no conflict of interest. Through the Key Population-Led Health Service (KPLHS) model, trained key population-led providers deliver comprehensive HIV-related service through 11 CBO across 7 provinces in Thailand. Key population in Thailand have high rate of sexually transmitted infection including chlamydia and gonorrhea, but CT and NG screening among at-risk population is not routinely provided. Among transgender women in Thailand, CT and NG prevalence were 23 and 14%. Among MSM, CT and NG prevalence were 22 and 16%. Objective of this study to increase access to service for STI were integrated point-of-care gene expert testing for CT and NG into the KPLHS service package for providing the counseling and prevention method as well as referring for treatment. At the 4 CBO in Thailand. Here we access rates of successful link treatment after diagnosis at KP-led CBO serving MSM and TTW in Thailand. The method point-of-care STI testing was integrated into KPLSH in August 2019. MSM and TTW were recruited during the first year of the study period from 4 CBO across 3 provinces in Thailand: Swing Bangkok, ASAT Bangkok, Empress Chiang Mai, and Swing Chonburi. First cat urine sample were self-collected by participants, while pharyngeal and swab and rectal swab were collected either KP lay provider or self-sampling. Trained KP lay provider collected attested single participant pool urine, pharyngeal, and rectal sample for CT&T using the gene expert assay at the CBO. Plasma for syphilis serology with rapid toponimo test and RPR test. When an STI was detected, the client was assisted to treatment service by CBO care and support staff to healthcare facility which with referral route were previously established. This included the acceptance of test results from the CBO by healthcare facilities, thereby eliminating the need for repeat testing. Definition in this study, STI event was defined as a positive laboratory test or symptom indicative of CT&G and syphilis and ended after treatment or once the test became negative. This means that one person could contribute to multiple STI events by the same cause during their follow-up period. If a next event was detected after treatment or after negative test, and successful linkage was accessed by each event by reporting from CBO staff who navigate the client to treatment press or follow-up phone call or live mobile messaging application when the client went to the treatment phase by themselves and was defined when completed treatment. Between August 2019 and July 2020, 1,008 participants, 87% of MSM and 13% of TTW were recruited. Among 875 MSM, 240 CT events occur. Of these, one received treatment shortly prior to testing. Of the remaining 239, 86% were successfully linked to care within a median of time 4 days. 174 NG events occur. Of these, 2 received treatment. shortly prior to the testing. Of the remaining 172, 81% were successful linked to care within a median of time 6 days. Lastly, syphilis, 98 syphilis events occurred and 84% were successful linked to care within the median of time 4 days. Among 133 transgender women, 33 CT events occurred. 67% were successfully linked to care within a median time of 4 days. For the NG, 18 NG events occurred. 67% were successfully linked to care within a median time of 4 days. Lastly, syphilis, 16 syphilis events occur, only 44% were successful linked to care within a median time of 4 days. In conclusion, for this study, integration of CT&G testing into KPLSH among population resulted in significant STI diagnosis with high rate of successful linkage to treatment service among MSM. Rate among transgender women were lower, indicated tailored strategies to link this population to care are urgently needed, such as link to transgender women friendly clinic, support for the treatment costs as well as the transportation costs, and promotional activity by peer influencer. Despite acceptance of CBO test result by the referral facility, time to diagnosis until treatment completion was long. Time to treatment should be further optimized by exploring methods for expedite treatment, for instance, fast-track referral option, integration of treatment service at CBO to facilitate same-day treatment. That's all my presentation today, and thank you for your paying attention. These are my acknowledgement for the study. Thank you.